Doctora, tenemos a la doctora JOANA BASTOS. Ella es profesora asociada del curso de Ginecología y Oncología. Fue decano del curso de Escuela de Medicina, profesor visitante de la Universidad de Stanford, docencia en educación médica y un fellow en FEMER. Doctora JOANA, no le quito más tiempo. Usted nos va a hablar de un tema muy importante. Ya dejé de compartir. Ya.
Muchas gracias. Buenos días. ¿Todos me escuchan bien? ¿Bien?
Sí, sí, le escuchamos, doctora.
Sí. Well, good morning, everyone. I'm very sorry that I don't speak Spanish, so we think that if I speak English, it will be easier for you to all understand me. Please feel free to interrupt me if I'm speaking too fast or if you cannot understand me. First of all, I'd like really to thank the FEPAFEM. I'm sorry. I'm very happy to be here with all of you. Also, congratulations for all the mothers here. My kids are 20 and 24, and in Brazil, Mother's Day is celebrated on Sundays. So either way, congratulations for all the mothers here. Well, I'm very happy to speak with you about the strategies to contribution from university from the medical course to community health. I have absolutely no conflict of interest in any of this presentation. Here is Unicamp, my university here in Brazil. And to start our conversation, I think it's very important for us to know that this is nothing new. The World Health Organization in 1995 had already pointed out the social accountability of medical schools. So this concept is that medical schools are obliged to direct their education, research, and service activities towards addressing priority health needs of the community, region, nations, and these health needs should be identified jointly by government, healthcare organization, healthcare professional, the public, and the medical course. The core value of that is equity, that is providing high quality healthcare and opportunities to everyone. The qualities that the more the health care you provide, the increases the likelihood of a desired health outcome. The relevance shows that the most important health issue should be tackled first. And efficiency is producing the great impact on health using the available resources. And also the Lancet published, it's not new also, 2010, a very interesting editorial about health professional for a new century, transforming educational to strengthen health system in an interdependent world. Also, I'd like to point out that this year's AMI Congress, the biggest Congress of health education, the theme of the Congress is also that how medical schools can help the healthcare system. So in this editorial, Lancet pointed out that we should reshape medical school curriculum to tackle public health skills, interdisciplinary collaboration, and leadership. And also that we have to meet the specific needs of health of population, especially in context of social and health inequalities. That we should engage community learning and healthcare experiences. That we also should train our students to teamwork, preparing to be to profess health and increasingly interconnected health system, and very important that medical schools have an important role in preparing the professionals who can address global healthcare challenges such as epidemics, infectious disease, and things like that, and to promote social justice and health. So we, as professors at universities, this is our obligation. We are interconnected to our health system. The education should meet the needs and the demands for workforce from the health system. I brought for you several papers. I will not expand on them, but we have lots of plans to integrate healthcare. And as you can see, we have papers from the United States, Canada, Cornell University, Stanford University, Harvard University, and this is not Duke University. This is not a Latin American problem. But I would like to talk to you, New Mexico, all those references is going to be with you, but what I'd like to point out is that we in Latin America, we have much more interconnected university to the health system. And I would like to share with you some solutions that we could achieve here at Unicamp to try to inspire you and share some solutions. So the most important question is that why we should contribute to community health and how this should be incorporated in our curriculum. First of all, the society supports universities. So it's usually an isolated word, but being a place where we can generate new knowledge, it's a duty of the university to help solve society's problems. Also, it's our duty to train professionals with social visions, activity in society, and to advocate for health. So here in Brazil and many other countries in Latin America, we have a national healthcare system that is public, and we have a national curricular guideline that we are obliged to follow. So, taking in accountability this curriculum, our medical course has priorities like diversity and inclusion, excellence in integrated curriculum, and in community health. So, to do that, we have, since the first years of medical school, the students have activities in primary care, not attending patients, but learning the health challenges from this community and listening to the community to know what the problem of the community regarding health is, not to go there and from our point of view, point the problems. The community should tell us what the problem is. It's important for a university to have a legal basis. So 10% of our curriculum is obliged to have to do programs outside the walls of the university to address community demands. 10% of all the curriculum, and it's a law in our university and in Brazil. It's important because the students learn what is important in the community, what the health problems are. They are aware that their duty as professionals is also to take care of the health problems of the community, not one single individual. And of course, to the school, it's important that we have a multidisciplinary approach and that we have involvement of all the community, teachers, administrative and technical support. So we must have a dialogical interaction, an interdisciplinarity and interprofessional approach to this to impact the students' training and impact the social transformation. So, as I said, it's an opportunity to change our curriculum. We here have 3 big areas that we work: health actions with vulnerable populations, science and health education, and health and environment. I'm going to tell you some initiatives. This is one of them that work with vulnerable population, homeless population, from migrants from other areas here in Campinas. And the aim of this program is not only to give health care with the students and with the community of the university, but to promote citizenship. Here we have another big project that it's a governmental agreement of the state of São Paulo and the university to work with teenagers undergoing social educational internment. It's like a prison for minors, and we provide medical assistance, promote citizenship by cultural development and educational support. We also work in women's prisons with the students, trying to address their local problems, their health problems. And it's a strategy that was financed by the OPAS from 2006, and it's still going. Also, we have agreement with the North government, especially Pará, that is a state of the north of Brazil, to work in boats that are hospital boats, that to provide assistance to the population in the Amazon River, the forest population, and to learn from them what they want and how can we help solve these problems, the health problems. Another very interesting initiative is to work with migrant women, and we did a manual of general health, what the particular necessities of this population of women, what they need from us. And we made a book for them and to train our medical students and our medical professors. And also regarding environment and health, our students visit factors and go to the field to identify environmental issues and to study the impact of the environment in health. This is one of the major programs that we have, that we work with homeless people in the city. We have a multidisciplinary team that work with support, healthcare, protection against the risks to which the homeless people are exposed, and made actions to protect and promote the rights of this community. As you can see, we have professors, residents, family medicine residency, psychiatry residents, and the most important, undergraduate students. All students go there and work with this team for a period of time to learn what this population needs and to empower them not only to give health assistance to this population, but also to advocate for this vulnerable population. Also, we have a mental health service to this population and also to other vulnerable population in the city. So we can go like 3 major ways. One way, one road to integrate public health in the medical course and in the university, discrete experiences like workshops or courses for the students and for the community, local elective disciplines and programs with community partnerships, and also experience abroad pre and post training. It's very interesting to do a longitudinal experience. So we can build in the curriculum a course that meet community needs and how we can start to understand to build it in the curriculum. And of course, when this is already inside the medical curriculum or any health professional curriculum, to incorporate this as a policy of the university. Here is a very interesting...
Dr. Joanna, excuse me, you have 2 more minutes.
Okay, I'm finishing my presentation, thank you. This is a very interesting paper that I recommend you to read. This is training to encourage the community and the university community to do a participatory research, to empower the community to understand their problems and to propose research with partnership with the university to solve this problem. So I like very much this slide. This is our team working with homeless people, and they do the healthcare sometimes with what they have in hand. So I think it's a very good parallel with our university, that we can start with what we have in hand to contribute to community health. So here they can they treated a fracture with a piece of a palm tree. So it's important. I would like to give you very few messages to take home. Is the most important thing is that the university is not an ivory tower. It's our duty to collaborate with the community health, and social accountability is a duty. University forums with the social instruments and the community is mandatory to identify the demands. Sometimes we see that we go to the community and tell them what the problem is and what the solution is. This is not the way to go. Community projects must meet the demands of the society and call into question knowledge generated at the university. Community activists help to train professionals with social vision and are active in our society. For the students, it is very important to the practical learning opportunity with the local community and made them aware that this is their mission, and also that their mission is to advocate for health. This is my last picture. I'd like you to guess, what is it? This is a picture from our outreach street team. This is a Christmas tree. They did that with what they have in hand. So the solutions should not come from us, but from them. Thank you a lot. I'm available to questions. And again, it's a pleasure to collaborate with all of you.
Doctora, muchísimas gracias por tan importante presentación y recordarnos la importancia de la relación universidad-sociedad. Eh, Gracias, le invitamos a quedarse al conversatorio más adelante en una hora si gusta conectarse. Doctor, espero